helping parents understand. I think it's a very interesting talk, and I'm going to sit in here and listen to this because I'm very
Good.
interested.
Oh, thank you. That's an honor. So morning, everybody. I am a very interactive speaker. I don't wait to the end for questions. So please, if you have a question, just raise your hand. If you try to hijack my presentation, I'm going to tell you to talk to me after. But certainly, if you have a question that's about your child or yourself, feel free, and we'll try to keep it relevant. We are going to go to 11:30, and right? No, we're going to go an extra half an hour. So I'm covering a broad range of topics, so some of them will fly through a little quickly. I'm trying to accommodate the time difference, but other times, we'll go deep depending on your question. So we're going to touch upon a lot of different things, but I just wanted to tell you a little bit about kind of who we are. So we're a group of clinicians. We're committed to integrative mental health, and we really try to merge neuroscience with effective holistic clinical therapies. We don't believe in medication in our practice. Yahoo! And we provide you alternatives to medication that are research-based and very effective, and we do a ton of things. You can look us up. I have the best website, if anybody's ever seen it. And I'm a certified school psychologist, a licensed professional counselor. I'm board certified in neurofeedback. I also interpret my own QEEGs, which it's definitely less than 5% of clinicians do, but maybe 2 to 3% of clinicians. And I'm the originator of a really cool program called 360 Reboot. I can go into detail. I just like to tell people my affiliation. So I'm on the board of a Northeast Regional Biofeedback Society. We promote biofeedback and neurofeedback in the Northeast. I'm a Lyme Connection Task Force advisor. Is anybody familiar with Lyme Connection in Ridgefield? If you know anybody or love anybody that has Lyme disease, they are amazing. And they do a beautiful free patient conference May 17th at WestCon with some of the top people in the world. It's amazing opportunity for people. And I'm on the board of Epidemic Answers, which is committed to children's health and well-being. It's a really great organization and one of the best, most informative websites about children's physical health that I've ever seen, and mental health. So today's agenda, we're going to cover a lot of stuff. So if something speaks more to you, please feel free to jump in and ask a question. Is anybody here in the room a professional? Is anybody here a parent? Is anybody a parent of a special needs kid? Okay, okay. So we're going to talk about why our kids are struggling. We're going to understand what's the difference between a developmental lag and clinical issues. I think it's really, really important to understand that distinction. I don't think professionals in general explain that to parents enough, and it really can help you to understand why your kid may need support. And I also am a believer in early intervention, and early intervention makes a big difference. We're going to talk about chronic medical issues, the rise in mental health issue, and issues in general. It's pretty astronomical when I show you some statistics. Just common issues in general, mental health issues, difference between anxiety and stress. We're going to talk a lot about anxiety, mental health red flags, signs of an LD. We're going to talk about school supports, understanding the difference between an IEP and a 504, and how to access help, and really what you can do as a parent to support your child at home and school.
What's an LD?
Oh, learning disability. Yep. So, okay, what's going on with my kid? I like this picture. My kid did a selfie on here, and I just think it's a cool picture. You can't really see it that well. So there are really a lot of reasons why kids struggle in the academic world, right? And things are changing. I have been in mental health for 26 glorious years, and I can tell you in the last 10 years in particular, there has been a dramatic shift. And I should say that I work with all ages. I work with mothers with babies. We work with very, very young children. We're one of the few practices that work with young children. And I work with the elderly. So I work with every age spectrum. It's just I'm really known for pediatrics. But kids are struggling for a lot of reasons, right? Do some of these things resonate with you? So developmental lags, I'm going to explain what that means. Medical problems. We're seeing a real dramatic increase in children with medical issues, and I'll also talk about anxiety, stress, lots of emotional dysregulation, sensory processing, learning disabilities, ADHD, autism spectrum. 1 in 36 children, new CDC rate, is autism. Okay, so it's a huge, huge impact all around. Personality. Some kids struggle because their personality, right? I have a kid like that, you know, so social pressures, social media, life stressors. You know, social media brings a lot of exciting things into your life. Some of you came to this conference today because you saw it on social media, right? Hopefully. But there's a lot of pressures for kids around that, and some of it's not so easy. So let's talk about what a developmental lag is. So when kids fall behind in any area, right, it doesn't mean academic. It's a temporary lag. So when we think of our kids, for all of us that are parents, and you think, you know, my kid's a little slow in this, right? You know, so I have multiple kids. Who has multiple children, right? So one kid walked on one timeline and another kid walked on another timeline. Pretty much most of your kids don't have that exact developmental kind of window. That can happen anywhere at any time with cognitive, social, emotional, speech and language, fine and gross motors, or sort of activities of daily living. What are activities of daily living? How about learning to flush the toilet? How about brushing your teeth appropriately? And I bring up those two examples because actually those are my two most common complaints that I get from parents. Other three would probably be like annoying their sibling. So when somebody is behind, usually you do some level of support. Like, oh, I realized my younger kid like didn't know his sight words. I was like, I'm not doing the sight words with him. Like, I just didn't do it like I did with my older kid, you know, like every day, the sight words. So, you know, we're doing it now, and guess what? He's not behind in his sight words anymore because we were slacky parents because, you know, we're busy. So, you know, with support and intervention, they move through these lags. This is not a developmental disability which kids don't outgrow when kids are younger, and it could be a true cognitive impairment. We'll talk about that. So it's when you're a little behind something, you get an intervention, and voila, okay? Things get better. In the school setting, this happens a lot with kids with reading issues, math issues. They're red flagged early. I have my own take on that. If your kid is behind in reading and early age, they're probably dyslexic. But anyway, but so when does it become a clinical issue? When, you know, the rule of thumb is something's been going on for 6 months or more, or you're putting a lot of intervention on it. I think this is like for those of us, has anybody ever had a child with a speech delay? You know it, right? Because it's so obvious that they're not speaking at the rate that they should. In these other areas, it can be harder to understand. So, for example, I just worked with somebody who they said, you know, my kid's developmentally behind in social. Well, he's been developmentally behind since he has been playing, and he's 10. So the parents really feel like it's just a developmental lag. No, it's not a developmental lag. It is a serious issue that people have been working on, have schools been working on. And so we know it's an issue because it's not gotten better, right? And in fact, it's gotten worse. So, you know, most of the time, you know, you should work through the process. You should seek immediate support when you have a sudden onset of a behavioral or emotional issue, there's safety concerns, or at any point you're like, I'm just gonna get some help. I mean, sometimes, you know, when you have your second or third kid, you just know, right? Something's going on. I'm gonna get some help. And, you know, depending on what the issues are, you know, you wanna seek we're talking a lot about mental health today and learning. You know, you're gonna wanna go to a psychologist. You can go to your pediatrician. I personally find the best way to get referrals is to ask your friends. Like, you know, your daughter had a lot of anxiety, and I know you loved her therapist. Who was that therapist? I mean, that's just the best way to seek help. Is that what most of you do when you kind of get stuck? Yeah. And some pediatricians are fantastic with giving a great list of providers, and some aren't as connected to providers. I know you have a couple really good pediatricians in town here, but I know people are coming from different. So chronic medical conditions, this is an astounding, and when I talk about statistics, I always include the citation for that, and if anybody wants a copy of this, they can leave me their email, and I will send it to them. But this is really interesting. So in 2011, we did this massive study of children, and 54% of American children have a chronic medical condition. 1 in 2 children have a chronic medical condition. That is asthma, obesity. Obesity really ramped it up, because not in our area of the country as much, but even though I did go to a town very close to here, and I was about 25% of the class was obese, and it wasn't a low-income town. But other issues, ADHD, learning disability, 1 in 6 children, autism, that's 1 in 45 now, we know it's 1 in 36. Pediatric depression, 1 in 30 kids have pediatric depression. Dysregulation, 1 in 30, OCD, 1 in 100. We specialize in OCD. We're one of the few places in Connecticut that do, and all I can say is if you have a kid with obsessive compulsive tendencies, get treatment immediately. You can put it down really quick, but once you get older, it's one of the most treatment-resistant conditions in addition to addiction that I personally feel. So this is is this shocking to people to see that 1 in 2 children have a chronic medical issue? And so there's a lot of pieces to that. So this is just a spelling out more specifically of that, and like I said, so 22% of American children will have a diagnosable mental illness with serious impairment. We're not even talking mild to moderate before they're 18. So, our mental health in our country is significant. We're at a crisis, really. And for me, anxiety and social issues are the biggest trend that I've seen in 10 years. That is kind of really where things are going. So most common anxiety, ADHD, depression, eating disorders, age 13 to 18. Those are our most common. And anxiety disorders encompasses quite a few things. It includes social phobia, OCD, panic disorder, and generalized anxiety are your top of under anxiety. So what's the difference between stress and anxiety? Who doesn't have stress in their life? Raise their hand. Oh, see, exactly. So it's natural response to stress and frustrations. Our job as parents is to teach our kids how to manage stress, right? I try my best every day driving an 84 not to have a heart attack. Get out of the passing lane if you're there. I'm just telling you right now. So, but anxiety interferes with our daily functioning, right? So it is when your feelings are disproportionate to what the situation is. The worry encompasses you. And that's children, that's adults. For anybody that's experienced any long-term anxiety, whether it happened for a situation or you're wired that way, or you're in perimenopause, male menopause, whatever. These are common times when you see shifts in anxiety, right? It's a feeling that lingers, it's there, it kind of hijacks. And there's levels, right? Some people have chronic low-level anxiety. There's always a level of irritability. But for some people, it can show as rage. We're going to kind of talk about all the different times. So we think of classic anxiety as somebody who's the worrier, right? The nail biter. They're nervous, they cry. For me, I don't see this one as often as I do the other ones, because kids are different. Kids show themselves in complete behaviors. But this is our classic, it should be called the classic, the worrier. But beyond the worrier, we have kids that are angry. They have physical complaints, right? So 80% of all doctor's visits are stress related in our country. So you're going to get, and this happens all the time. Like I just got somebody this week who came in to me, and they've gone to every doctor. They even did like a 1-week stay at a children's hospital, try to figure out what was going on, couldn't diagnose it. So somebody, of course, a friend said, well, it's probably stress related, because it is. And vomiting and nausea. And I'm like, how many times have I seen that? So, she's doing better. Let's see, week 1, doing better with some of our treatments. You might see a kid who's perfectionist, and there's school avoiders, kids with learning and processing issues. There are other factors that interfere with anxiety. So I see the angry a lot. I see this in younger kids, and I see this in teens. So somebody who's anxious, who you're not going to think of them as anxious. You're going to think of them as being cranky and irritable. They always have to have their own way. They escalate very quickly for unknown reasons. They go from 0 to 60. They're typically going to have peer issues because, you know, if you're cranky and you get mad a lot, who wants to hang out with you? They often are very bright. They can be impulsive. They have trouble transitioning and overall emotional dysregulation. They get upset easily and can't recover easily, okay? That's really huge when you are really worried about your kid. It's the recovery as much as the actual getting upset. They're perfectionists. So I see this a lot in girls in middle and high school. They'll show themselves in elementary. This is as much a personality as, you know, it is a serious issue. They cry, they do a lot of corrections, they look for adult affirmations, they're people pleasers. They're very worried a lot about things being done a certain way. These are kids sometimes when they're little, they won't go down the slide, right? You have to kind of nudge them if any of you have a kid like this because it has to be a certain way. They're worried how it's going to be. So kids, just because you have anxiety in itself doesn't mean that you don't have something else going on, right? You could still have a learning disability. But these kids in general who are very anxious tend to be brighter kids. They can have focus issues. You might see a variety of other things that along with it, like taking a long time to finish your work. They can present with behavioral issues or depression. They might have problems with learning. They give up easily and easily frustrated. Anxious kids give up pretty quick. Their frustration tolerance. Go ahead. This is your son, right? Yeah. So, and then, you know, you want to ask, is there a reason why they're so anxious? We want to think about where is that stemming? Is there a learning disability in that as well? Because school is hard. Is anybody here a teacher? Okay. So school is very hard, it's very fast-paced, and most children are doing developmentally inappropriate work. Kids today in first grade are doing what they did in third grade just a few years ago with Common Core coming in. Since Common Core has come in, our practice has increased by 50%. So yeah.
Why isn't the word out there yet?
Parents are buying into it. They're on the train. They're on the race to nowhere.
I don't think they're buying into it. I don't think they understand what it is.
Well, it's really hard. Our system is set up. When you say they don't understand what it is, I'm talking about something different. Like everybody wants their kid to get into an awesome college. That is our goal with children today. Our goal is not to create independent, happy children. That's where our shift has been. So even when I get very well-meaning parents in, they are like, but if they don't do this, then they can't get in that advanced math class. And I really need them to get into that. Oh yeah, oh yeah. They know that by sixth grade you're tracked for high school. If you don't get into sixth grade, you don't land in a certain, particularly in math. Is anybody here a middle school teacher? If you don't land in sixth grade, your whole math career will be different.
Okay, but I don't think parents are buying into it. I
don't think every parent is.
No, but I think they're extremely frustrated when their child brings work home.
Yeah.
At least I'm in Region 14. I think the communication is not very good.
You mean from the school to the parent?
And the community, yes.
Okay.
I mean, at times it is, but everything is digital. Parents work, they're not looking at their screen.
Here's what's happening in general.
But I think it has to do with the money,
What has to do with the money?
funding the school.
You mean the cost per pupil, slowing things down?
The only reason they do Common Core is to get funding.
I think you're absolutely right that we have to have certain monies available to us federally and we have to do certain things. I don't disagree with that, but there's been a shift in our culture to accept anxiety as a part of our daily life, including myself. right? Who doesn't have some level of stress that's probably ongoing in our life? And I'll talk about stress. Our body doesn't know the difference between good and bad stress. So I think what's happening is, in general in education, it's not just Common Core. We've shifted our ideas about what life has to look like for kids. Like, I see kids taking on $300,000 student loans to become a teacher. I mean, and why? You know what I mean? Like, so there's that didn't happen when I went to school in 1989. You know, it just didn't happen. You know, so we have a little bit of our cultural shift going on that's part of this. I think there's no one answer. I think it's multifaceted, and I think there's a lot of pieces. But parents come to me because they've had enough. They want somebody to guide them. And sometimes I guide people to different educational options, including homeschooling and private schooling, or looking at, there's a learning disability, that's why the kid's so anxious. There's a lot of factors. 1 in 2 children have a chronic medical issue. How is that not a factor in their learning?
Parents
There's
are-
some teachers, yeah.
Okay. Common Core is a set of standards. So that is not really the problem. The problem
Is the implementation.
well, and the problem is that educators are not the ones who are writing the curriculums or the
Good point.
textbooks or.
Oh, this is not an
promoting
educator issue. This is a systems issue. The
It's
teachers, I think, are
cultural.
as frustrated in a lot of ways
Exactly.
as the kids, right? So, you know, I know of teachers that have told me they have to, like, in kindergarten and first grade, you know, like, put a cover over their door so they could still do art, you know, and things like that. So, you know, yeah. You know, we know that we're doing all this research about the impact, I'm going to talk about it, of exercise on brain functioning. We really need to do that? Of course kids are better when they exercise. Go ahead.
You know, I went to school when you went to school. It boggles my mind
Yeah.
that my son, who's 6 years old in kindergarten, you know, gets a 30-minute lunch period where he can't talk for a good portion of it because he gets too rambunctious. And if the weather's nice, we live in the Northeast. If the weather's nice, he gets to go out. I don't even know for how long, maybe 15 minutes.
Exactly.
And he's in school from 8:20
Yeah,
till 3:20.
right. With a real increase in seat work.
Right.
Yeah, I mean, it's
So
kind of
boggles
tough.
my mind.
Yeah.
And you know, that we should feel, you know, inadequate because he's not sitting still and learning. I can't sit still and learn. And I'm 40.
Some schools, I just this year have seen a couple of schools go back to a second recess because, you know, up to 10 years ago-ish, most schools had 2 recesses a day. You know, we know that movement increases the ability to focus, so it will improve. It's hard. Teachers are trying to fit everything in. It's very, very hard. It's very, very hard.
Squished in both
Yeah.
directions and not getting paid well.
Oh, yeah, not in Connecticut. If you're from New York, you get paid pretty good. But you know, these kids, in terms of being anxious in a class, I mean, they can look like anything. They can be timid. They can have ADD. They can be angry. They can have sensory issue. They can correct the teacher, right? If you have a kid, a younger kid, and he's correcting the teacher all the time. Oh, sorry. If he's correcting the teacher all the time, he's probably on the spectrum. I'm just going to tell you that because they're usually so smart. But they interrupt. They can look very, very different, and it's hard. I just want you to understand that anxious kids don't always have to be. It can be just anxiety, and I don't want you to think that there's like they're going to be okay. They're not going to be horrible human beings, but they need some help. You know, need some support. So here are emotional signs or behavioral signs. You know, trouble going to sleep, nightmares, fatigue, irritability, overly sensitive, anger or range, long temper tantrums, you know, high frequency. I have a great blog on temper tantrums and meltdowns on my website, if I do say so myself. So, you know, they get distracted by worried thoughts, frequent erasures. I'll get a lot of kids that won't turn in their work. So that's always a red flag. That doesn't have to just be ADD. They get a lot of test anxiety. So you're not going to know the test anxiety until they start taking tests. Holding of bladder and bowels, that's a serious issue, you know. Excessive sweating, frequent urination, hyperactive, and sleep problems. Sleep and gut stuff is a really, headaches are big, you know. So in the class, when they're little, these are the kids that had a hard time separating. You could have no difficulty separating and still have anxiety later on. Have to have argumentative, interrupts, same things. So, anxiety is definitely a serious issue that we don't want to neglect. I'm not going to do a ton on depression. Depression is there. I see it much less commonly. When I see depression, I would say 80% of the time, I see long-term anxiety first, and they get physical depression. Their body actually gives out because of the chronic stress, right? So your body is not physiologically designed to deal with chronic stress for long periods of time. So 12.8% of the population, 12 to 17, experiences at least one major depressive episode a year. And you can look very functional with depression and anxiety. That's another thing. Depression and anxiety always impacts attention. People come into me with ADD. A lot of times it's something else. And obviously I have the luxury of a QEEG brain map. But ADHD, a lot of people have ADHD. A lot of adults, a lot of kids. It's real, it exists, and it's really a neurobiological brain disorder. You have an increased risk with family history. One of the biggest things you'll see with ADHD, because people with ADHD and particularly dyslexia have a higher IQ than normal. They usually are very bright. You'll see an inconsistent learning profile. So A, C, F, B, F, all over the place. So you have to look at that in the scope of things. You have a question?
I have a question.
Yeah.
And it's because I can't remember the answer. My grandson has, I don't know if he has ADHD or ADD, but it's not this normal thing that you're talking about. He was a preemie, and it's associated with that.
So if you were born before the 33rd week, your frontal lobes did not get a chance to develop. You didn't cook long enough. So you literally will have ADHD because your frontal lobes didn't develop. So he's inattentive type ADHD. There's different types of ADHD. There's hyperactive, there's impulsive. It's all called ADHD now. It's with or without. A lot of times people have ADHD in conjunction with another issue. And a lot of things can look like ADHD, including Lyme, learning disabilities, head injuries, anxiety. If you're anxious all the time and you're looping, you're not paying attention to what's going on. You're thinking about my looping thoughts. And anxiety is so unique. Like I get a lot of social anxiety and individuals with social anxiety, and when they're able to really talk about it, they sit there and think about, I said hello to that girl. And they're literally sweating it out and over-processing, how did I say hello? Did my voice sound okay? These people aren't crazy. They're just experiencing that level of intense anxiety that it's a looping, overbearing thought that goes over and over. So signs of a learning disability, I broke it down, preschool, they're late talkers, a lot of speech. There's a lot of developmental lags and delays with early learning disability, problems with sequencing, problems with peers, those kind of things. Oh, what just happened? So grades K through 4, lots of learning stuff, right? So the phonics. If you have a problem with phonics early on, you're probably going to have a problem with reading, and there's a real connection to speech and phonics. It's the same exact area in the brain. We do a terrible job in the state of Connecticut identifying children with dyslexia. Our teachers just this year in their teacher training who've been trained in Connecticut are just getting dyslexia training. So it's going to be 10 or 15 years. We are so behind New York and particularly Massachusetts. People don't understand dyslexia. If you get the right treatment for it, you're going to learn to read beautifully. The problem is these kids are not being identified. They're not being picked up. And it's not like you can't read when you're dyslexic. You can't read well. So that's very confounding to people. And they need direct phonics instruction. This whole language stuff which pops in is not going to happen. But, these kids have trouble following directions. They can be impulsive. Lots of difficulty learning new concepts. And retention. Like, I worked with my kid on that, and they don't remember. you know, and they were right there with me, those kind of things. And you also, as a parent, and goes along for all grades, if you're having to reteach the homework when they get home, there's a problem. They're having a problem retaining. Either the teacher didn't successfully administer that and all the kids are having that problem, then we know there's an instruction breakdown. But if they're really struggling with understanding what is a review and you're reteaching, they're not absorbing the instruction. So that's really, really important. Now the kid is older. So what you're going to see in grades 5 through 8 is a lot of handwriting issues. You're going to see the math breakdown. So they might have known the concept here, so they could do arithmetic. I can do addition, I can do subtraction, multiplication, division, but now I got a word problem, or now I have multi-step problems, and they can't get that information. Math problems are much less common than literacy and writing problems. They just are. There's a lot of reasons for that. So, but you're starting to see they're not self-monitoring, they're not regulating. What did you just read? I don't know. They don't have that kind of skill. So high school, obviously you're going to start to hear failures, you're going to start to see inconsistent grades, but what you're going to see is memory problems. You're really going to see writing problems. They're not able to keep up with the work at the pace. Your kids might be tracked to the lower. They might be in teams classes. They might go from a straight algebra to an integrated algebra. And sometimes these things occur, and your kid, again, kids with learning disabilities are bright, so they can learn to compensate and look a little different. So you're not as aware that, oh my God, there's a learning disability here. It's not unusual for me to test somebody in 11th, 12th grade or college, or even adulthood. So and your kid may or may not be on an IEP, a special education plan. We'll talk about that at this point. And just because you have an IEP doesn't mean your kid has the right educational plan. So when do I ask for help? So when and how? Your kid is behind. Your kid is behind their peers. I like to ask, where does my kid fall in comparison to the other kids in the class? That can be pretty telling. I was in a meeting recently, and they didn't want to give this kid writing help. And the teacher said that they had, when they write, that they have to check on a minimum of every 5 minutes the student's writing. And I asked if there was any other student that required that level of support in the class. They said no. And I said, is there any other student that has to be checked on every 10 minutes? They said no. I said, what about 15? No. My answer was, we're not giving this kid an IEP. And their writing was absolutely abysmal. So I'm just going to tell you we got a writing goal on that IEP. But academic failures, inconsistent grades, you don't have to be failing to be doing poorly in school, okay? So it means the process of it. It's labored, it's hard, and especially for you that have multiple kids. If your one kid is really struggling, I did this, and Amy came out okay, and she's doing okay. But Jessica is just not getting there. I mean, what's going on? I parented them the same way. I did the sight words every week. So you got to really look at maybe there's something going on. Well, my grandfather and my brother are dyslexics, and Uncle Bobby has a math disability. Maybe Jessica does. So they're working really hard. They're resisting school. So I'm seeing kids resist school for a lot of reasons today. I'm sure the teachers in the room can answer that. It's absolutely not just because they have a learning disability. A lot of anxiety, a lot of emotional reasons, a lot of social reasons. It's a frustrating place. A lot of my kids are movers. They're physical, kinesthetic learners. And I just had a mom this week say to me that their 7-year-old came home and said, school, they take the joy away from me at school. And this little boy is right in this circumstance. So, he needs to move. So I don't think schools are bad places by any means, and I think a lot of kids do very well. It's just when you have a kid who doesn't fit in that box, it is very, very hard today to make it because of the pace of instruction is very, very, very fast. Go ahead. Yeah.
Sixth grader asked me, how old do I have to be to drop out of school?
Yeah.
He's done.
Yeah, I'm sorry. Yeah, it's hard. It's hard. And we don't want to extinguish that love of learning because then they think I'm dumb. And then they don't get to contribute to the world in the way that can really show their light. You know what I mean? So, because, you know, he might be gifted, I don't know, artist, whatever it is, you know? So I think that's really important to do that. So peer relation concerns, I never want to neglect that. It's really important. Please know that if your kid is having a peer problem, it doesn't mean they're being bullied, okay? Bullying is a pattern of somebody going after your kids. Do not ignore that. And do not let anybody get away with that either, because that's really important, and we have good state laws on that. And it's not always appropriately. Yep.
How much of this not liking school and having difficulty struggling with learning is the fact that the foundation is really not there?
You mean in terms of?
I don't think enough time is spent, you know, preschool, the child gets it, but they're very young and they're starting to prepare them for kindergarten. So I just don't think there's enough manipulatives, there's enough concept building with actually doing.
Well, they keep pushing the educational activities further down, and our country, I think we're making a mistake. I mean, you look, when you correlate the happiest countries in the world, Sweden, Finland, Canada, and Australia, always in the top 5. The Swiss and Finland, they don't introduce academics until age 7. It's all play-based. I mean, and we have a happier country. And it's cold and snows there all the time, you know what I mean? So I'm like, how does that happen? But there's
they also do well academically when they do it.
They do, because they're giving it at a right developmental time. So when we talk about giving things more to younger kids, I think of more play, more social, because kids are getting a lot less unstructured social, and we're having an increase in social problems, right? So kids are like, don't know how to do. And I tell you, my college professor says, you know, friends are telling me these kids are getting to college and they don't know how to do anything unless they're being told. I mean, there's 40% of freshmen in college either flunk out or leave. That's a long-term statistic. You can Google that. So kids are not being prepared. So you know, you always want to seek help if there's an emotional or a behavioral change related to school learning, anything. You know, if something's going on at home and there's something significant, yeah, you want to at least let your teacher know and see, you know, there's a lot of wonderful supports and there's a lot of great teachers and support staff in schools. So what's a 504? What's an IEP? Simple version, you know, your Cliff Notes versions. These are both federal laws that provide for people with disabilities, right? So does anybody here, you know, familiar with it or have a child? Okay, so a 504 provides for modifications and accommodations only. You have something that you need that is relatively, I don't want to call it simple because every school district decides to interpret it differently, and federally, that you can do whatever you want under 504. You can give as much as you want. Massachusetts does the same for 504 as they do for an IEP. So they're so far ahead of us. People move to Massachusetts to get, I have 2 kids right now who I'm working with. They both have concussion, long-term concussion, and they're on a 504. So we're doing flexible days. One's in high school, one's in middle school. They're allowed to make up work. We're trying to get rid of stuff. School system's being fantastic, really easy. I have another kid on a 504 in another district. They're giving me a hard time. And so it can even be speech services at a young age, but it tends to be things like extended time, upfront seating, accommodations. IEP means you need direct remediation. Something is so severe, you need somebody directly to work with you. So you're autistic and you need behavioral planning support. You have ADHD and you need executive functioning support. You have a math disability, you need somebody to directly work math with you. Though that's the difference between the two. So even though they're both federal laws, an IEP has a lot more protections in place for the child. It is very specific. There are a lot of rules around it. The 504 is very gray. They're both important, they're both good. That's really the basis of what they are. And there's government oversight on both. Again, a lot better government oversight because the rules are more specific with an IEP. So when you really think that your kid needs help, okay, always put it in writing. Please remember that. If you remember anything about asking for help with a school, always put it in writing. Don't mess around with that. I can't even tell you how many times I'm writing in a report that the parents asked for testing, or they asked for this, or they asked for that, and they were told no, and there was no documentation of it. It has to do with technical parts of the law, so it's really important. Be really specific about your concerns and present a solution if you have one. If you have one, like I really would like, my kid has social anxiety, and her best friend is Maddie, and they do really well together, and I need for them to be in a class together. You know, sometimes the school district will honor that. Sometimes it has to come through a 504 and IEP. Always start with the teacher. You know, teachers are good people. I mean, and they want to do best by your child, and talk to them. If you don't get anywhere and you're not progressing, there's things you can do. You can ask for a meeting with a principal or specialist. You can ask for a 504 or a PPT. Always consider bringing an advocate in the state of Connecticut, especially. Has anybody ever used an advocate here? Okay. So I just can't say better money spent with the whole IEP process. Everybody crosses their T's and dots their I's, and you're going to get a much better program for your kid. And it can be nice. And then, you can get your own private evaluation. You don't have to. And go ahead. Oh, an advocate, it's an educational advocate is what you would Google or look at. If anybody wants the name of one, I'm happy to give you. I have a few that I absolutely adore.
You can bring, if you do get your own evaluation, you can bring your doctor in.
Right, but they're specifically asking for an advocate. So so I do evaluations, but certain towns, I won't go into the meeting with you unless you have a separate advocate or a lawyer, because the town is so difficult. I won't say that because I'm on tape. But ask me after. And you don't have to get your private evaluation, and we'll talk about when it's important and when it's not. So schools can help by identifying things early and talk to parents about behaviors. This is a very tricky and dicey area for schools and teachers, because if they recommend something specific, like I had a school nurse recommend a very specific doctor to a parent, the school is obligated to pay for it. But teachers and specialists can say, you know what? Johnny is really impulsive and can't keep his hands to himself, and it's really interfering with his play. And this is what we're doing here. What can you do to support me at home? Talk to me about, does he have play dates? Are you sitting next to him? You don't have to be an expert, but giving parents really specific information is so valuable. I mean, when I do detailed histories with parents, which I do, it's amazing to me the trail is there. Some of my parents are desperate and asking for help, and other parents are like, why didn't they just directly say that to me? So it's hard, and it has to do with I'm that person, don't come to me unless you don't want the straight truth, because that's me. And some parents don't have that. So schools, don't ignore parents. Parents are asking for help because they believe there's an issue, and you have to partner and you have to work together and find a middle ground. Some kids have no problems physically at school and are a nightmare at home, and vice versa. So we have to look at that, and we have to work together. Teach self-regulation skills in the classroom. Sensory breaks, because we're not doing enough movement. Sensory breaks should be occurring multiple times in every classroom. I don't understand why they're not, but you'll get a lot more learning. And what's a sensory break? Doing yoga in a classroom, or I have teachers do 5-minute dance party. Whatever it is to incorporate some movement, these kids need to move. Careful seating placement with matched peers in learning. I am totally against negative reinforcement. Do you know what negative reinforcement is? You probably all had a kid that was either in a red light, green light, or yellow light. We are reinforcing negative behaviors, so every time they did something naughty, they moved down. Yeah, it's our research from the 1950s says it doesn't give behavior. So we should do the opposite. We should be giving points when they're doing positive. We can do practice ignoring. Go ahead.
So is it terrible if your child, say, is doing something that they know they shouldn't be doing? Say, if we don't, sit try to at least finish this, then we cannot have a play date later.
Oh, that you're talking about your parenting.
Yeah.
Oh no, parenting, you say, this is what we're doing. What I try to do is say, I need you to do 1, 2, and 3 in order to get this, right? So you never take away, if your kid is really behaviorally dysregulated, they're probably gonna never make a play date if you use that as an opportunity, as a punishment, right? So instead, we wanna just try to, like, no matter what, they're gonna have their play date, because let me tell you, there's nothing more important than play for a kid for many, many reasons, but it will really help them in their quality of their life. But you know, you can certainly say, like, we're not gonna go to this movie if you don't get X, Y, and Z done. The problem is when you pick your behavioral items, right, at home, you never want to have more than 5 things that you're working on. I like to work on 3 or 4 things, and you want, let's say you pick 3 things. 2 things are things they do all the time. So they make their bed, or they brush their teeth. And the third is a medium item. And if you have a 4th or a 5th, it could be a stretch. But never put more than 1 stretch item. So the point of a behavioral system is that they are earning success. If we have 5 things they're never doing, they're never going to be successful. They'll give up. They're, you know, and this is all based on behavioral theory. So you can do it 1 or 2 ways. You could just do it as a positive reinforcement system when they earn nothing, right? But you also can have categories of things that they earn. Kids with behavioral issues need a high level of reinforcement. They're not going to be able to go a week for something. It's just never going to happen, right? For those of you who have older kids, you know exactly what I'm talking about. But I believe privileges, everything is earned. Your media, your phone time, everything is earned. However, for children with any level of social issues, I never, ever ban a play, any kind of play, anything, because they need that so desperately, because they're going to learn, especially if it's with a typical kid, they're going to learn more appropriate behaviors. They're going to come out feeling positive and good about themselves. I mean, kids start developing negative feelings really early, right? So, you know, you have the 7-year-old saying, taking the joy out of my learning. You know, that's not unusual for me to hear things like this, you know. So we want to keep that, that's important. That's a good question. And so school interventions, there's a lot of different interventions. There's formal plans, there's sensory breaks, they're teaching breathing now, all different things, giving kids a toolbox of things that work for them when they're experiencing stress or a learning problem, you know, understanding feelings, social stories. I mean, they can do a lot of different things, and it's great, and I think it's good. So what can parents do at home? So, from one tired mother to another, I'm actually not that tired. I sleep pretty good now. But practice self-care. So if you're not practicing some level of self-care, and I don't mean that means going to a spa, even though I do, and I go for regular massage and all kinds of stuff, but it means you're practicing some level, even if it's 10 minutes a day. You do a little yoga, you meditate, some level of kind of stress relief activity, because you are the model for stress management for your kid. And we know, this is the truth, when we got our stuff together, we handle stress better, right? So when my kid's falling apart and I've got my stuff together, it's a better outcome, right? So that's really important. And then, you know, lots of communication, spending time on enjoyable activities, which can be really hard. If some of your kids have restricted interests, you're going to have to stretch yourself and listen to Minecraft talk for 30 minutes. I'm sorry. And pretend like you know what you're talking about. You know, if your kid is sensitive, and that means they're either emotionally sensitive or they're sensory, think about their needs in advance. You know, we're super clean eaters at our house, so I have to plan all my food out in advance. We, just to take that out of the mix. You know, physical exercise, connecting on that, simple walking. We have an unfinished basement, which I love, and we have a little sensory gym kind of activities, a little trampoline in there, just different. And sometimes we just go in there for 10 or 15 minutes. We turn on some fun music. Diet and nutrition, I'll talk a little bit about that. That's huge. You have control over everything your kid puts into their mouth most of the time in your home. and it makes a huge difference in brain health. And when you have concerns, seek support. We're in a community, there are a lot of providers that do a good job. There's some other ones that don't, but there's a lot of good ones in there. Homework. So one of the biggest things I hear about from parents is homework. Have a routine. I don't have an exact routine for you. This is specific to you and your child. If your child likes to come home and take a break, let them have a break. If your child needs to do their homework as soon as they get in, let them do their homework. Think about their sensory needs. Do they need to move? Working in short spurts is a lot better, so 15 or 20 minutes, then have them get up, move is a lot better. You can use sensory needs, you can use seltzer, chewy foods, like beef jerky, nuts, things like that, all help to activate the brain and stimulate. That is not permission to have Cheetos. Remove distractions. Some kids, like myself, I love music when I'm working, and I need noise. I really do better when there's a little noise there. Most people do best with the hardest task first. It just has to do with your energy, and then you wane. If that becomes a battle, then don't do it. But if it takes too long to do homework, you gotta let the teacher know. Some teachers don't know the kid's spending. I had one kid, they were spending 6 hours in middle school doing his work every day. So we let them know, we got him some support. Okay, so I'm super anti-medication. I just want to give you guys a little data and information about medication. I'm all about respecting people and their own choices. I'm never going to shame anybody, but you need to know. So there's no science behind the use and selection of medication. They look at a symptom and say, this is what you should take. So I have a real problem with that, and it's not really working. We have lots and lots of information available to psychiatrists and medical professionals. They can do genetic testing to look at appropriateness of certain medications. This is all common knowledge. Big, article in the Journal of American Psychiatry in 2015 saying that you need to do genetic testing. So hardly anybody does it. And not all mental health issues result from chemical imbalances. That's what medication is. It's chemical imbalances. There's a variety of reasons. Could be situational. It could be nutritional deficiencies. It could be medical issues. There's a lot of components in it. And guess what? Since our dramatic increase in medication, our mental health is declining in children. So it's not working. So let's think about other things. And long-term effects of medication. So this is with children with ADHD. ADD meds, time and time and time again, 3 years completely lose effectiveness. So, and that's for people that don't have reactions to the medications. So these are common reactions: cardiovascular, seizures, tics. And some of these can be long-term. Once you start the tic, I have many, many, many kids who started tics with ADD meds and never lost them. OCD, I have 2 people I'm treating right now, psychosis from one use of medication. Irritability, depression, insomnia, all this, reduced growth, all that, leads a gateway drug for substance abuse later. So 2014 study showed 100% of children who used methamphetamine, which is Concerta, Ritalin, all that, 100% had a adverse reaction. They're called ADRs. Number 1 was anorexia, so restricted eating. 2 was irritability. 3 was insomnia. So just know with what you're doing, they pass out Ritalin like it's candy. But it is there. Here's all the citations for that. If anybody wants that information, I have that. So we're moving towards integrative treatments. I'm going to have to breeze through this, but this is my passion. This is what I love. Go ahead.
I just have a quick question. What's your feeling about a gluten-free diet?
Oh, I love it. I'm living it. It's good. We'll talk about it. I promote an anti-inflammatory diet. Okay, so an anti-inflammatory, there's a lot of diets that are anti-inflammatory. I'll talk to you a little bit when we get to that. So, integrative treatment, safe, effective, research-based. You're taking a multi-pronged approach. You're not going to do one treatment most of the time, and it's going to be a miracle. Okay, we're now dealing with 50% of our kids have a medical issue in there, right? So why is your kid special? They probably have it. We have genetic mutations like it's nobody's business now. 40% of people have a genetic mutation we're going to talk about. 54% of parents are using complementary and alternative treatments for ADHD, but only 11% are discussing it with their physicians, because physicians, just an FYI, they don't even have one nutrition course when they're trained. They just don't have that integrative base unless they do that. So I believe the foundation for healing, and this is what we believe in our practice, and we have 15 practitioners in our office, we believe in addressing nutrient and genetic issues, diet and nutrition, sleep. Guess what? If you're not sleeping, your body can't heal. We're very dismissive in our culture of sleep. 5 hours of sleep is not enough, people. I'm just telling you. You got to have at least 7. And stress management. So stress. When you have stress, your body cannot heal, okay? Your physiological system, this is so, I want this to be an aha moment for you guys, a total paradigm shift. Your body is physiologically designed to deal with stress first and healing second, okay? So it's most understood if I have worked with a lot of folks with Lyme disease, right, all ages. Your nervous system will always, your whole body will always, T1 and T2 regulators will go after the stress before they'll go after the Lyme. And that's why a lot of people in chronic disease states, autoimmune, dramatic increase in autoimmune diseases and chronic disease states in our country, is because the nervous system is a constantly an agitated state. So I try to really explain, obviously I'm Italian, I talk a lot with my hands, but what happens in the nervous system, right, is just this constant stress, right? So it's here, it's here, it's here. And it can be because of a variety of things, genetic stress, home stress, school stress, chronic disease, but your nervous system is here. It's supposed to be here so it can go up and down and moderate, but instead it's always here. One thing happens, we have overflow. We have breakdowns, we have depression, we have physical pain, and it's just this constant. And it's because we're now conditioned ourselves as a culture to a chronic stress state. But even without that, your body is, if we don't have daily practice, we can't let, our central nervous system never relaxes enough to let it do the work in the other areas. So that's really, really important. And we do a variety of things to get the parasympathetic and the sympathetic nervous system aligned so the body can work better in the brain. And you often just get a dramatic, improvement in, attention and focus and all of those things. So these are like super, super, super easy ways to, limit media. After 22 minutes, your nervous system is either over or understimulated. I mean, how am I gonna not, I try to take breaks, but it's hard. Teach stress management. Our kids love, of all ages, do well with sensory things like art, pottery, EFT, there's lots of things. Learn a true sport, a life sport, like karate and swimming and those kind of things. Tennis, those are gifts you can give your kids that they'll be able to walk away with and learn to use that for stress management. It's really, really important. And, nutrition. So diet, did I say diet? So I believe in an anti-inflammatory diet. And what that means is it's reducing or eliminating gluten and dairy. Absolutely no sugar. Sugar has no nutritional value. You can have honey, you can have agave, and you can have maple syrup. So there's lots of ways to cook. And really increasing your fat. Our American diet is very low in healthy fats, so avocado and nuts and all those things. Has anybody ever made like a huge diet shift? I know you eat really pretty clean. Your brain works on a whole other level. You feel so, so different. Now, when I give people this information, I'm not trying to shame you or make you feel bad or anything. Even if you could do 20% dietary change, I promise you, you will feel a difference in your brain and your body. It makes a difference. If you're not willing to give up wheat, please do organic. Our American wheat is loaded with pesticides. So it means that if your liver has to always overwork, your brain can't work properly, because I'm all about hijacking the brain to make it work better. So diet is really huge. You had a question for me in the back.
Oh, what were EFT?
Oh, EFT is emotional freedom technique. It's tapping. There's a presentation today. These, things like EFT, EMDR, meditation. They're ways tools for you to use to get your nervous system to calm down. But it's a wonderful, technique where you tap along certain meridians and you make statements. It's super easy to use. You can get onto tappingsolution.org and look for videos. And on YouTube, if you do that, and it's great. It's great. And the Ortners are local. They're here. They're Newtown people. They run the Tapping Foundation. They do a great job. We do all kinds of things like neurofeedback and biofeedback. I love my PEMF. I'm going to show you that. Meditation, craniosacral, hypnosis, Reiki, reflexology. Has anybody ever tried any of these things in this room? Okay. Get out there, people. Get a massage, for crying out loud, right? You know what I mean? So, but there's lots of things that you can do if you're really worried about yourself or your child. There are other alternatives that have a lot of research behind them and are very effective. So I love neurofeedback. I'm going to show you a quick little video. I think it's the bee's knees. I think it's great. I think it should be available at the gas station. When you fill up, you get a little neurofeedback. It's just that amazing. And it treats a variety of things.
We are going to extend this session until 11:35.
Oh, I better hurry up.
And everyone can proceed to the cafeteria.
Okay.
for lunch.
That's all they extended. Okay.
And please remember to fill out your survey.
Okay. So really, really simply, I use a lot of tools. This is neurofeedback. Ooh, shoot. We figured out how to do it. This one is what did it. Give it a second. Hold on. Nope. 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 Ah! It's not going to work. It's all right. We're going to run out of time. I just want to show you what it looked like. So it operates on the subconscious. It's this really simplistic thing, neurofeedback, where you come in, you do this beautiful thing called the QEEG brain map. I can tell you basically what you had for dinner last night. And I can see nutrient deficiencies. I can make really, clear, oh yes, this is definitely ADHD. Yes, diagnostically, this is anxiety. And I make a protocol. So it's about changing your brain waves. That's all that it is. You come in, you are getting reinforced for changing your own brain waves in this lovely, simple process where through the use of computers. In our office, most people watch a movie. The movie won't play unless your brain changes its brain waves. It does it in 2 or 3 seconds. If I have a second, I'll pull it in. But it's a really lovely, we got it working before. I don't know what happened. American Academy of Pediatrics, the certifying board of pediatricians says neurofeedback is as effective as medication since 2012. So every pediatrician should be telling you, but they're not. There's thousands of research studies, positive outcomes, 3,000 peer-reviewed studies. All the research says it's way better than neurofeedback. We just had one that come out, better than medication. Long-term, 6 months, 2 years, they're all say long-term, it's very effective.
Is it covered by insurance?
It can be, depending on your insurance. At our office, we do add a network for everything because we want to protect our clients' privacy, but also it allows for better coverage by being at a network. So, but it's a wonderful treatment. Biofeedback is different. You're learning. Has anybody ever tried biofeedback here? Okay, so it's very old biofeedback. It's probably over 100 years old. You're learning to control autonomic functions, so your heart rate, your breath. There's a beautiful one that you can buy on Amazon for a couple $100 called Inner Balance. It's HRV training, which is heart rate training, heart rate variability, and it lets you sync your breath and your heart rate. It's awesome, makes you feel much more relaxed, improves your focus. It's good for anxiety and depression, and it's a couple $100. So it's a wonderful, wonderful tool. Again, that's not gonna let me show it. So genetics, this is really important. So we're now understanding that we have, has anybody ever done a 23andMe profile? Gift yourself that, it's $199. MTHFR is one of our most common genetic American mutation. About 40% of the US population has it. It's associated with like everything. So I've never met somebody with bipolar that didn't have it. I've never met a child who was autistic that didn't have it, but it's also associated with stroke and heart attack and a variety of things. It's a mutation that has to do with how your body utilizes the B vitamins and aminos. And without B vitamins, your nervous system can't work properly. So you develop conditions like anxiety and depression. It also has to do with detoxification. So toxins build up in the brain and the body, and you're more likely to have mental health issues and autoimmune disorders as a result. There's a bunch of other genetic mutations also called COMAT that's very strongly related to anxiety. Nutrients. So people think, has anybody ever worked with a naturopath here or a nutritionist? Okay. So what those folks do is they identify your nutrient deficiencies. So we think, oh, I'm low in vitamin D. Who here knows who's here has ever been told they're low in vitamin D? Okay. If you are low in vitamin D, your entire hormone and nervous system cannot work properly. How about that? So, so they'll say, oh, you're low in vitamin D or you're on the low end of average. You're in trouble if you're on the low end of average. I mean, if you're not directly supplementing vitamin D in New England in the wintertime, and even if you're in the summer, you better be out without some sunblock for 15 or 20 minutes a day. You are going to be low in vitamin D. So there's a lot of research that shows how essential fatty acids, magnesiums, the B vitamins, again, now we know B vitamins are linked to this genetic mutation. So even if you're directly supplementing them, your body can't work correctly unless you get a more bioavailable form that's designed for people with that genetic mutation. Zinc, amino acids, all directly related to improving attention and anxiety. Lots and lots of research. I could go on and on and on about that. So our diet, our Western diet is totally associated with symptoms of ADHD, depression, anxiety, just tons and tons of research about it. We know that food elimination has improved symptoms, so common food, mostly dyes. Our body isn't designed to have food dyes. I mean, there's lots of alternatives. The good news for all of us that are healthy, cuckoo banana, healthy eaters like myself, there's lots of alternatives now. I mean, your Caroluzzi's has the deli meats that have hormone, pesticide free. I mean, there's really, really good alternatives everywhere. They have a great organic section. Gluten-free diet has been shown to reduce symptoms of ADHD. It's about reducing inflammation. That's what the gluten, taking away gluten and dairy and sugar is about. So there's lots of research about that. So I already mentioned exercise. Hello, why do we need research to show us that you're going to be a lot more focused when you exercise? I mean, I got up and worked out today. I'm on fire, So parent training. If you're really struggling with your child's behavior, it's really a wonderful thing to get support from a professional. It really is. It helps to eliminate a lot of guesswork, and we're trained to give parents support, and I love it, and it can be so effective. Because if you go take your kid to see somebody once a week, it's probably not going to make a difference. You have to have the parent implement those things over time, and never ignore behaviors. It's really important. So we're into executive functioning training. Meditation's amazing. Okay, so red flags. Don't ignore red flags. And this is true. I've never had somebody said, oh, I regret getting help. Right? I only get people say I regret not getting help. And I don't want to scare people, and we are here under, Parent Connection, but I do see a lot of kids where you know they're on the path to doing self-destructive things like taking drugs and alcohol. And we want to avoid that. And the way to avoid that is good self-concept, feeling positive about themselves. They don't have to be perfect, Yep.
Do you know of any particular program? keynote speaker other than Ruler, that the schools implement that is a good self-esteem, character building program?
I mean, people use, it really depends. There are a variety of ones being used. That is not a commonly used one in Connecticut.
Right, but do you know one where they are getting really good results and they're?
No.
That's what I'm looking for.
Yeah. So, I mean, I think it depends. I mean, you know, people are using specific anxiety programs like rosanne and getting good results. You know, we're having, it's hard to have one program that encapsulates everything. But it's not a bad program what he's doing. It's effective. There's research behind it. Yeah.
No, I'm not
Yeah.
talking about, I'm just talking in the school today. I think our school is doing step 1 or something, step 2, second.
There's a
step,
lot of
something.
programs out
But
there. Yeah.
I don't think it's doing it. I don't think they do enough.
It's one piece. There has to be help and support on the outside. We have to look like, you know, building things at home. So therapy is like a good insurance policy you're never going to use, right? So like we all have insurance. We can't drive in the state of Connecticut if you don't have insurance. Hopefully you never need it. So that's what good therapy is. It doesn't have to be like you're going to sit there and talk about how you hate your mother. I mean, it can be very directed at what you need and support. So I think that is really important. So get psychoeducation and support, right? So, you know, we pride ourselves on giving people understanding. It's kind of shocking to me how many times I had somebody recently come to me and they had seen over 50 doctors. That's my record. Before that, I was 33. And she said, oh my gosh, you put it all together. And I thought, well, why wouldn't I put it all together? But I don't think people are giving people a kind of support and understanding. And when you understand how the brain and body and all those pieces work, I think you can be more, you can feel like you can do more, right? So getting parent coaching, again, the diet, nutrient deficiencies, genetic testing, and then always start with integrative approaches. You know, we are trying to make our free thinkers and our movers abnormal, that there's something wrong with them. God help me as a child today in the schools. I still got in trouble in 10th grade for talking in class. I did okay. I graduated from my doctoral program early, so I think I'm all right. But I would never make it today. I would be very conflicted, and I'm sure I would just, you know, I just wouldn't do my work. So we need to support our free thinkers. And so sometimes they're not the problem. It's just where they're at isn't the right. So you either have to figure out how I can make that system work or think about other ways if you have the means, right? And I don't always think private school is the answer. So resources, I have lots and lots of blogs and things. It's under my news and media. There's great. If you ever have a special education question, the State Department of Education has great stuff online, and you can always call for a free educational consult. I don't love them anymore. They used to get a random person. Now you have to talk to the person assigned to your town, and I find that they're too friendly. And sometimes they tell the person. But LD Online is a great resource for parents with learning disabilities, and just has tons of information for you. So we're in Ridgefield and Newtown. This is a way to get a hold of me. I have cards and info. We do free parent workshops at least once a month in our office. We really try to support. We just did this whole 21st parenting series about just everything from young children to teens, and we try to take requests and build our free workshops based on what people request. Thoughts, questions? Did I shake it up for people a little bit in here? Hopefully you took something away today. You have a question for me?
Question on
Yeah.
autism. You're saying it's going up dramatically.
Yeah.
Is that because of diet or other effects, or is it because
There's no-
better at measuring?
No, for sure there's a difference. I mean, I've been in the field for, I think it's 27, but let's just say 26 years. You can see a difference. So we used to think it was only advanced maternal age. It's not, because a lot of young mothers are having. We don't have a direct source of the exact reason, but they do have a higher rate of genetic mutations. And a lot of these, they also have higher mitochondrial difficulties. They're more susceptible to vaccination injury.
Or
No, the children themselves, they're themselves have mutations. And their mutations make them more susceptible to vaccination injury. They can't tolerate it, so it builds the toxins up in their body. There's a whole bunch of other things. There's also a lot of gut issues, microbiome issues that are causing brain dysfunction. I mean, genetic, but for sure, like I said, I've never met somebody with bipolar and autism who didn't have that one mutation. And a lot of my children, a lot of my children who have autism have a family history of bipolar. So there's lots of connections going on. We don't have an exact reason why that is, but it is very, very dramatic. It's 1 in 36 kids, and I think we do a terrible job identifying the high functioning kids, because I'm always fighting with schools.
How does that compare with other countries in the developed?
Oh, we have some of the highest rates of autism. So, and China had one of the lowest rates of autism until in the mid 2000s or early 2000s. We sent our vaccinations with thimerosal over there. They had a 1,679% increase in autism. So I don't want to make this a vax thing. You could just educate yourself and learn and understand. It's the vaccination itself. It's that we're getting children with a lot more genetic mutations that can't handle the toxins. There are toxins in there. So that's one piece. There's a lot of pieces to that puzzle that have to do that. I'm sorry, you had a question?
Yeah, what is the mutation?
It's MTHFR. So right here.
Oh, okay.
Yeah, MTHFR. 23andMe is a way to get those tests done for yourself very inexpensively. Go ahead.
For college, going off to college, would you suggest is a 504 better or an IEP?
Well, you can't have an IEP in college.
cannot.
No, and a lot of school systems in our area falsely tell parents that they should come off their IEP to get them ready for college and put them on a 504. That's baloney, and that's stupid talk.
Can you change the
And
IEP to the 504 towards
yes,
the end of high school?
yes. No. You straight in an IEP. If your kid needs an IEP, don't get off. Okay, remember that. And then when they go to college, there is no IEP. It's 504. And you're going to obviously be very mindful of the schools that you're picking. You want to make sure when you get your final testing in high school that you have grade equivalents for all their levels, including math, reading, and writing. This is often a big surprise when they find out their kid is low average, but really their grade equivalent is like 5th grade in reading, and they're going off to college. Happens all the time, trust me. So you need a fresh evaluation for college. It must be done within 2 years, max 3 of going to college. So junior, senior year, most kids, you need an evaluation in order to get a 504 in college. Absolutely critical. You cannot have services in college unless you have an evaluation. So they will not give it to you. They don't care what IEP you have. So that's really important. Yeah. So I know that. See how I know that? I knew that. So somebody else had a question. Okay. So you guys have been a good bunch. You're all going to eat a little more spinach and avocado. And good luck. Be well. Hopefully everybody enjoys the rest of the day. So thank you. Okay. Take care.